fly now. But when I was, learning, it was, I usually, don't ever get it to where, like, you want to do 10 things and have one ABC, 2 ABC. I mean, you'll have so much to do, you won't ever get through it. Like, I usually, like, especially when I was a student, you want to, all right, I want to do a little bit of bed mobility, I want to do a little bit of mat stuff, and then maybe stand, and go from there. Because when you get in there, they may need to go to the bathroom, they're having too much pain, their blood pressure's up, there's going to be so many other variables that will mess everything up that you've already planned. So sometimes when you're so planned, if something's thrown into that, you can't get out of it. You're like, oh God, I was going to arrange them and now I can't, and now I don't even know what to do. So you want to have a general idea of what you want to do based on the eval. So you look at the eval, you see what the patient's doing, and then you just kind of come up. But usually when I'm looking at the PT eval, and you can't quite do it in school, but you're looking at the PT eval, you'll also have the whole entire patient chart with them. So you're not just looking at the PT eval, you always try to look at the OT eval, and then read their H&P, read their history. Why are they in the hospital? Did they come from acute care? Well, if they did, they didn't come from home. Do they have shoulder arthritis and knee arthritis? Well, maybe I can't do running anymore, I can't do this. So while I'm reading about them, I'm trying to put something in my head and then I'll hit the highlight. Okay, they're leaving in 2 days. They need to be able to transfer with this. Or the PT left me a note. We need to practice slide door transfers, get in the car. Usually, I never want to go into a room, and if the therapist has been teaching them on a walker for 2 weeks, I don't want to go in there and completely change it up. And now I teach them not to walk with a walker. I want to do what they've been learning, but at the same time, I want to do what's best for the patient too. And I just have a general overview of it. And then having the things that you learn, like using the TheraBand or the ACE rep or NDT poles or the bedside table, you can kind of go from there. Sometimes I've had people to where, they're doing high-level balance stuff with them, and then when I get in there, I'm doing a little bit lower-level stuff with them, but it's also the first time I've seen them. I haven't worked with them for a week like they have, so I want to see what they can do and explain it to the patient. This is the first time I've seen it. Because you'll get the patient, don't touch me, don't touch me. Right? I've never seen it before. I've got it in my hands, I'm sorry. And then go from there and see how the patient does, the patient reacts.
One of the things that I find that work for me tend to forget is to look at the goals. Mm-hmm. Maybe they did the eval a week ago, and then they've been treating them, but they never go back and look at what the goals are. And if they would, they'd realize, oh, they're out of date. Or, oh my goodness, they've already met these goals, I need to make new goals. The PTAs are wonderful about letting the therapist know, okay, the goals are appropriate, they're not appropriate, they're out of date, I really need you to come back and reassess. And then using those goals in the plan to focus your treatment. Like he was saying, you can have a picture in your head based on what they did the day before with whoever they worked with, or maybe it was you. And okay, my plan today is I'm going to go in and I want to try and walk. And you get in the room and then your plan is shot to pieces because they're sick, they got to go to the bathroom, or whatever. You want to work on bed mobility and they're up in the chair and you're like, oh crap, they're already up. Use whatever you walk into, whatever situation, use it to your advantage. Okay, so they're in the chair, let's start in the chair and let's, do something there and then end in the bed. How long have you been up in the chair? You've been sitting up for 6 hours? Okay, maybe they want to rest. But don't underestimate the benefit of working on the little things when they're in bed. A lot of people hurry to get them out of the bed, but that rolling, like he was showing, and that kind of thing, that not only it warms them up, it helps the core. The core is so important to everything you do. It warms that up. You can see how strong they are and that kind of thing. And it's really beneficial to the patient. It might not seem like you're doing much, but really you're seeing a lot. Their endurance, can they do it? How quickly do they fade? And it is true therapeutic in our treatment. So don't underestimate those little things. Putting their shoes on, can you reach forward? Can you put your socks on? And then use that. Keep your balance, find your midpoint, whatever, that kind of thing. And use that as therapy, not as just something you have to do to get to your treatment. That is actually part of your treatment. Make it part of your treatment. Make sure you're looking at every little thing that you do. Or they sit up and they've got bedhead. Really mean, and the little old ladies, they get their hair perfect. And you're like, well, here, have your comb, fix your hair. And so while they're doing that, they're using their balance and everything to pull their hair. So incorporate that in, all those little things, incorporate it into your treatment. It's part of it.
And I always look for that one thing you can talk to them about, like, what do you like to do? What are your hobbies? Where are you from? You know, because you can say, well, I'm from Pilot Mountain, and they'll say, oh, I know so-and-so from Pilot Mountain, you've got it again. Or, you know, what do you like? And if you can find that one little thing that you can talk to them for that, you still like, all right, let's talk about safety, but then you can go back to that. It kind of makes them feel better too. And then whether or not, I'm not telling you to lie, but whether or not you even talk to the doctor or not, when you go into the room, if you're saying, hey, you know, I was talking to Dr. Pollock, and he wanted us to come in here and work with you, blah, 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 because you'll get the patients that aren't wanting to do anything. Well,